Today I am going to teach you scrotal lump examination. How to examine scrotal lump? Your examiner will ask, please examine this patient's scrotum. First of all, I should tell you that, especially for girls, this area is much more beautiful than what you can see here. Boys, isn't it? Yes, this area is much more beautiful. Not only beautiful, this area is much more complicated. Why is that? There are a lot of diseases, there are a lot of pathologies associated with this area. So you have to have good knowledge and skillful hand in order to differentiate those diseases. Your examiner asks, please examine this patient, beautiful complicated area. Now you know the area. Girls, are you going to examine straight away? No. This is the one and only secret area in our body. So we need to have consent. So girl, you should take consent first. Boys as well. Take consent, number one. After taking consent, you can expose. You have to expose well. Number two, expose well. Then try to palpate spermatic cord. Try to palpate spermatic cord. Do you know that there's a thing called spermatic cord which carries sperm from the testis to penis and then into the outside? This is your testis. This is your spermatic cord. Try to palpate spermatic cord. Here. If you can palpate spermatic cord separately, that means lump is below the spermatic cord. It can be either here, it can be either here, it can be either here. If you can palpate spermatic cord separately, that means lump is below the spermatic cord, below that level. So it can be either hydrocele here, it can be either epididymal cyst, it can be cyst of the cord. If you can palpate spermatic cord separately. If you can't palpate spermatic cord separately, that means lump extending from here to here. You can't separately palpate. Lump extending from here to here. That is Inguino scrotal hernia. That is Inguino scrotal hernia. Now you can differentiate a little bit of diseases. If you can separately palpate spermatic cord, that means it can be either cyst of the cord, epididymal cyst, or hydrocele. If you can't separately palpate, then it is Inguino scrotal hernia. Next one, number 4. Check whether you can feel testis separately. You can palpate testis separately. Here your testis. If you can palpate testis separately, you can palpate testis separately, but there is a lump. You can palpate spermatic cord as well. That means lump is from here to here. It can be a cyst of the cord. It can be an epididymal cyst. It can be an epididymal cyst. So, if you can palpate testis separately, it can be epididymal cyst. It can be cyst of the cord. But your lump is very close to testis. Most of the time, you can palpate testis separately, but lump is very close to testis. You can palpate testis separately, lump is very close to testis. Then it is epididymal cyst. The lump is little bit far away, that is cyst of the cord. If you can't palpate testis separately, lump is here. That is what? Hydrocele. That is hydrocele. So, if you can palpate testis separately, that is cyst of the cord or epididymal cyst. If you can't palpate testis separately, that is hydrocele. Next one, check for the fluctuation. Keep your finger like this and press. If your finger separate, that is fluctuate. That means it contains fluid. You have to check for the cross fluctuation as well. Cross fluctuation as well. So that means it contains fluid. Check for the fluctuation, that means it contains fluid. Check for the transilluminate. Check for the transillumination. take a pen torch from here to here, switch on. You can see brightly trans-illuminate here, red color, bright trans-illumination here, like a gem. If you can see trans-illumination, that means the fluid which present in the lump is clear. That fluid is clear fluid. Can I ask question? Can you trans-illuminate your testis? Yes or no? Boys, today you can check and put a comment below. Then girls can identify whether boys can trans-illuminate testis or not. So my question is whether trans-illumination is possible in testis or not. Next one, you have to check for the contralateral scrotum as well. Not only affected scrotum, contralateral hemiscrotum, not the scrotum. We don't have two scrotums. Contralateral hemiscrotum, you have to check. Next one, number 8. Ask your patient to get out of the bed. Can you stand for me? Then patient is stand. What are you going to look? If your patient have hidden inguinal hernia, it can be obvious that now. Why? Now sac can easily come down. So you can identify inguinal hernia. Not only that, dilated venous in the scrotum, varicoceles you can also see. So you can identify varicoceles and inguinal hernia by asking your patient to stand up. So those are the things you are going to do in your examination. Now your examiner asks, okay, please continue. Tell me your diagnosis. Are you going to straight away jump into diagnosis? No. You have to give clues for your diagnosis. So you are going to present like this. Now I am going to give the findings. You are the one going to make the diagnosis. Are you ready, boys and girls? Yes. This is our first patient. He is having a lump confined to right hemiscrotum, which is fluctuant and trans-illuminant. I can't separately palpate the testis. I can get above the cord. There is no inguinal hernia or varicoceles. Left hemiscrotum is normal. What is your diagnosis? It is a hydrocele. It is a right testicle hydrocele. Next one. He is having a lump confined to right hemiscrotum, which is fluctuant and brilliantly trans-illuminant. Brilliantly trans-illuminant. I can get above the cord. There are no inguinal hernias or varicoceles. Rest of the hemiscrotum is normal. I can separately palpate the testis, but there is no distinct gap between the testis and lump. There is no distinct gap between the testis and lump. What is your diagnosis? Epididymal cyst. Your diagnosis is epididymal cyst. Last one. He is having a lump confined to the right hemiscrotum. Right hemiscrotum. I can separately palpate the testis. There is a distinct gap between the testis and lump. That lump is fluctuant and again brilliantly trans-illuminant. I can get above the cord. I can get above the cord. There is no inguinal hernia or varicoceles. What is your diagnosis? Your diagnosis is cyst of the cord. Your diagnosis is cyst of the cord. That is how you are going to present. Once you finish your presentation, examiner will ask several questions from you. He will ask, please tell me, following your successful examination and diagnosis, your examiner will ask few further questions in order to give more marks. Question number 1. Okay, Dinusha, tell me What are the type of hydroceles you know? There are two types of hydroceles. Primary hydroceles, also called idiopathic hydroceles, and secondary hydroceles. Secondary hydroceles are due to trauma, sometimes due to tumor, or sometimes following inguinal hernia surgery. Those are called secondary hydroceles. Next question. Are all hydroceles transilluminant? I already told you hydroceles are transilluminant. Question is, are all hydroceles transilluminant? Answer is no. Sometimes chronic hydroceles, due to calcification of their walls, will not transilluminate. So chronic hydroceles sometimes may not show the features of transilluminant. Next one. Why do we operate on hydroceles? Why do we operate hydroceles? Number one, it is cosmetically unacceptable. Cosmetically unacceptable. Cosmetic lesion. It interpose. Large lump here. It is totally impossible. Interpose. Then you have to operate. Next, it can traumatize. Here large lump. It can easily traumatize. It can infect. So for those reasons you have to operate. Cosmetic, interfere with intercourse, traumatize, infection. Because of those risks you have to operate. Next one. What is the management of epididymal cyst? Are you going to operate all epididymal cyst? Answer is no. There is a risk of subfertility. So young patient, the management option is reassurance. Young patients. Why? There is the risk of subfertility. For the old patient, due to pain or some other factor, you can operate. Old patient, you can operate. Young patient, the choice of treatment is reassurance. Next one. What are the main type of testicular malignancies? Do you know there is a thing called testicular malignancies as well? What are the two main types? Teratoma and seminoma. Teratoma more common in less than 30 years. Seminoma more common in, more than 30 years. More than me, I think like this. Teratoma young, seminoma senile age. That is how I keep in remember. Teratoma teenage, not teenage, less than 30. Seminoma senile. It is dangerously easy to keep in mind. Next one. What is the management of them? Teratoma or seminoma. Are you going to remove testis? Yes, but not the trans-scrotal method. Here your testis, here your testis. This testis got teratoma. Are you going to cut here and remove testis? No. There is a risk of skin contamination with malignant cells. Because of that, high inguinal approach from here to here they operate. High inguinal approach operation is the one going to do for them. There is a risk of skin contamination with malignant cell if you are going to cut scrotal. Next one. What are the cause for painful scrotal swelling? Epididymal cyst, is it painful? Usually not, but rarely can painful. Hydrocele, is it painful? Again, usually not, but very rarely it can be painful. But when you come into epididymoorchitis, it is painful. Epididymoorchitis. Or torsion of the testis. Torsion of the testis or epididymoorchitis, painful. Okay, shall we go through again? What are the type of hydroceles, primary hydroceles, also called idiopathic hydroceles, and secondary hydroceles, may be due to trauma, surgery, tumor. Next one, are all hydrocele transluminant? No, due to calcified wall, it will not transluminant sometime. Next one, why do we operate on hydrocele? Cosmetic lesions, in intermediate intercourse, trauma and risk of infection. What is the management of epididymal cyst? Young age, it is a reassurance. Old age, you can operate. Next one, what are the main type of testicular malignancies? Teratoma and seminoma. What is the management of them? Trans-inguinal approach or high inguinal approach. You are not going to cut the scrotum because of risk of skin contamination of malignant cells. Next one, what are the causes for painful scrotal swelling? That is epididymal or torsion of the testis. That is all regarding the scrotal examination. Thank you very much.